Hyperhidrosis is a condition characterized by excessive sweating beyond what is necessary for regulating body temperature. This sweating can occur in specific areas or affect the entire body. It can be a significant source of discomfort and embarrassment for those affected. Here's a detailed overview. Types: primary focal hyperhidrosis, palmar hyperhidrosis, excessive sweating of the hands; plantar hyperhidrosis, excessive sweating of the feet; axillary hyperhidrosis, excessive sweating of the underarms; facial hyperhidrosis, excessive sweating of the face and scalp; truncal hyperhidrosis, excessive sweating of the torso. Less common. Primary hyperhidrosis often starts in childhood or adolescence and may be due to overactivity of the sweat glands. It's usually not linked to other medical conditions. Secondary generalized hyperhidrosis. This type is related to an underlying medical condition or medication. Common causes include medications. Certain drugs can increase sweating. Medical conditions. Conditions such as diabetes, hyperthyroidism, menopause, infections, or tumors. Neurological disorders. Conditions affecting the nervous system, like Parkinson's disease. Symptoms of hyperhidrosis include excessive sweating. Sweating that occurs more than what is required to regulate body temperature and can interfere with daily activities. Sweat stains. Noticeable sweat marks on clothing, which can be socially embarrassing. Skin issues. Skin irritation or infections, such as fungal infections, in areas of excessive sweating. Emotional and psychological impact. Increased stress, anxiety, or embarrassment due to the condition. Diagnosis of hyperhidrosis involves medical history, discussing the onset, patterns, and triggers of sweating with a healthcare provider. Physical examination, assessing the areas affected by excessive sweating. Diagnostic tests. Gravimetric test measures the amount of sweat produced over a specific period. Starch iodine test involves applying iodine to the skin and then starch to measure sweating by the color change. Blood tests to rule out secondary causes related to underlying medical conditions. Treatment options for hyperhidrosis vary based on the severity and type of sweating. Lifestyle and home remedies. Antiperspirants. Over-the-counter or prescription strength antiperspirants can help reduce sweating. Clothing. Wearing loose, breathable fabrics and moisture-wicking clothing. Topical treatments. Prescription antiperspirants, containing aluminum chloride, which blocks sweat glands. Medications. Oral medications, anticholinergic drugs e.g., oxybutynin, glycopyrrolate that reduce sweating by blocking nerve signals to sweat glands. Procedures. Iontophoresis uses a device to pass a mild electrical current through the skin to reduce sweating. Botox injections. Botulinum toxin injections can temporarily block the nerves that cause sweating. Effects typically last for 6 to 12 months. Microwave therapy destroys sweat glands using microwave energy. Surgical treatments. Sympathectomy, the surgical procedure to cut nerves that stimulate sweating. This is usually considered for severe cases and may have side effects. Surgical removal of sweat glands from specific areas. Behavioral therapy. Cognitive behavioral therapy (CBT) may help with the psychological impact and stress associated with hyperhidrosis. Management and prognosis. Ongoing management. Regular follow-up with healthcare providers to monitor the effectiveness of treatment and manage any side effects. Psychosocial support. Counseling or support groups to address the emotional and social impact of the condition. Prognosis. Hyperhidrosis is typically a chronic condition. Treatments can significantly reduce symptoms, but ongoing management may be required. The effectiveness of treatment varies among individuals. Conclusion: hyperhidrosis is a manageable condition with various treatment options tailored to individual needs. If you're someone who knows experiencing excessive sweating, consult with a healthcare provider to explore the most appropriate treatment strategies. Effective management can greatly improve quality of life and reduce the impact of the condition.